Time now for Around Town.
Hey, Ana.
Hey, good morning. It's a gorgeous day, so it's skateboarding season again. We're at Grant Park Skate Park, and we are talking to Dr. Robert Wysocki of the Midwest Orthopaedics at Rush Hand, Wrist, and Elbow Institute. Good morning.
That's a lot to say. Good morning, Ana. How are you?
Because skateboarders tend to have injuries mostly on wrist, elbow, and hands, right?
It's true, and really a lot of that comes from the way that they fall and the way they get injured. And I think a reason why a lot of the skateboarding injuries can be worse than the average injuries you see is you're not just simply falling down on your hand walking along. When you watch these guys, they're both moving at a high speed and they're getting height. So they're falling from a height, they're going down at a high speed. You can get some pretty bad injuries from that, and that's why we see a lot.
We've also seen an increase, but that's because the sport has gotten even more popular, you think?
It has, and when you look at the initiative programs at towns and across the city, the number of skate parks that have even gone in the last 5 to 10 years, there's really a big draw.
How many of these injuries end up in surgery?
Unfortunately, it's a pretty high percentage.
Really?
If you compared it to like a kid or a teenager who gets hurt playing soccer or something, it's just this is a higher velocity injury than we see. I mean, just in the last month, I've had 2 kids, one with a wrist dislocation, one with a fracture combined with dislocation of the elbow, both of which are surgical. And as as your viewers watch, you'll understand why when you see the way these guys move.
They're young, so they recover well?
That is true. I think they're a very motivated patient population. They're actually really a pleasure to take care of.
Oh, good. That's good to hear. That's good to hear. So how do you prevent these injuries?
So there's a lot. I think at the beginning it's using protective gear, which I think your viewers have seen already. A helmet, of course, for head injuries, elbow, knee braces.
All those guards.
I think a lot of it is knowing your level, is knowing that you should skate with people who are of your same level, highly skilled, not around beginners and vice versa, and not doing tricks that you're not capable of yet. Just like skiing and snowboarding. If you can't do double blacks, you don't go down double blacks yet.
Yeah.
And same with the rails or the large ramps. Don't do that if you're not ready for it.
There's a website you can go to, right?
Yeah, skatesafer.org is a website we put together with a lot of the local parks with a lot of good safety information.
That's wonderful. We will have more great tips to keep your kids and not so kids, because a lot of adults do this too because they think they're kids, coming up around town. But for now, you're watching WGN Morning News. We'll be right back.